TB screening, reproductive health, and education in the schools. I will say right now, my only capacity has been for tuberculosis case management. And that's what I've done all day, every day, from the time I get in till the evening. So, and thankfully for technology, now that, so if someone has active TB, it's not an option not to take medication, and it has to be by direct observed therapy. So I case manage everyone, all of our active cases in the villages that I cover, and I have to watch them every single day, take every single pill. Many times it's 12 pills a day, even for the children, even for the little bitties. And so it's very hard and very time consuming. So Jeannie knows, Jeannie knows, a pioneer public health nurse. She knows it's very hard, very time consuming, but thankfully with technology, we can do it by video. So I try to be very accommodating, and the greatest thing is just building rapport with the families. And if you don't have that, then they're not on, yeah, it makes it a lot harder. That was it.
Yeah.
Yeah, my name is Susie Nunn. I'm the WIC coordinator here in Dillingham. So first of all, the early childhood interdisciplinary team, ECA group. This is a group that comes together, lots of different community partners, people here. Some examples: Head Start, obviously ILG, 4-H. Lots of groups come together, and the point is to really share information of the family programs that work with early childhood. We also collaborate on projects. So the fun children's fair that we were talking about last night was a lot of fun, and it's a great opportunity to come together and collaborate. Because if one agency were to do one entire thing, it would be just so much for one agency. But when we all come together, we do our little table, it ends up being a great fun event. It's not overwhelming, a lot of fun.
Susie did so much for the lead screening, so much to help me with the lead screening clinic.
That was a lot of fun. No. So those are just kind of some of the examples of what ECA does. We also collaborate on village travel to other communities too. We do these young children's fairs and Head Start communities, but can with other travel as well. Usually we meet the third Wednesday every other month, but a lot of times we do combine it with the HSAC committee. So that one will be, this next one will be a combined meeting next Thursday. Yeah, so if you are not already getting emails from me and you would like to, that is my email address, and I'm very happy to add you to the email group. We don't really have a leader of the group, it's just kind of a group of partners, but I'm the one that sends out the emails. So feel free to email me.
And then you can also tell her if you want to be added to the HSAC group to tell Susie, and she'll let me know.
HSAC stands for Health Services Advisory Committee. It's a Head Start requirement, so.
I would give it on health services with it. WIC, just a little bit about WIC. I'm sure probably most people know what WIC is, but just to let you know, it's a income-based program that provides healthy foods and nutrition education to moms and babies. So just it's welcome for all families with kids under age 5. So it's not just moms. It's, you know, dads can apply, grandparents can apply. Foster kids are automatically income eligible. So if anyone has a foster child, we really encourage you to apply to receive. I know it takes a while to get the money from OCS, or sometimes it doesn't even happen. So we can provide that right away. So they get the food from a local WIC approved grocery store in the Bristol Bay area. It's only Dillingham, King Salmon, Kodiak, and then Good News Bay. Sometimes their store's working. So for everyone else, they have an option to do online or phone ordering, which is a kind of a relatively new thing, which has been great. So then they can choose the types of cereals they want and all those things. So they all get the same healthy foods on the WIC program. It's just depends on where they do. And then a very new, very new exciting thing that we now are working with a program called Pacify. It's a breastfeeding support. Have you heard of that? Yeah. Yeah. So the state of Alaska just entered a contract with them. So for WIC participants, they can now do Pacify, which is a breastfeeding service. So they have a way to opportunity to connect with an international board certified lactation consultant. So like the highest quality of lactation consultants. They can do it by video, by phone, by chatting. It's an app that they use, and it's completely free for WIC participants. And that's a 24/7 thing. So if they're having problems at 2 in, they can chat or do video calls. So really, really exciting services. Yeah. Just came this week. So. Yeah, that's our email address there. If anyone has any questions about WIC or help paying someone to apply.
Susie, I had a question.
Yeah.
Does the money for WIC for the families, is it regional based, like how much they receive?
Yeah, so most of it it's item based. So they get,
Okay,
3.5 gallons of milk no matter where they live.
so it doesn't matter the price. Okay.
The only thing is the fruit and vegetable voucher, which obviously fruits and vegetables are very expensive here. So that would be nice if that was regional, because $26 of fruits and vegetables does not go as far as here as it does in California.
3 apples, there you go.
Bunch of. Great.
Hi, everyone. Like I said, I'm Jeffrey Waite. I'm one of the audiologists here. The person I was going to be presenting was Sean Smith. He's actually on the plane coming in. So, I'm happy to kind of just talk about what we do in audiology. It's really cool as well to put some faces to names. A big part of audiology is management, and we're always looking, especially with our kiddos when we're working with them, we're always looking for all of those resources and services. So it's really awesome, to kind of be here and to kind of meet some of you guys. I've been here for about a year or so, but I'm kind of in and out, not here all the time, and so it's good to kind of meet some of you guys. But it's myself and, like I said, Sean Smith. We're the two audiologists here. BBHC does have full-time audiology now, which is awesome. We kind of split the role, and we've been working together for many years in different roles at different places, and so we kind of understand each other. We kind of like to provide the best services, high quality hearing healthcare, which is kind of what I'm gonna talk about a little bit. So according to Emmett et al. 2022, the incidence of hearing loss in rural Alaska is a lot higher than in some other places that maybe some of you guys have worked with. It's 30% here versus where most people are in the low 48 is about 2 to 5%. So there's a lot higher incidence of hearing loss. And that's based on many different factors, and it encompasses many different types of hearing losses. We have our conductive hearing losses. You guys are all familiar with the kiddo who's just always having AOM. It's a much higher incidence here. And chronic AOM causes a whole lot of other things, leads to a lot of different surgeries and things like that. Any kind of structural issues that that you could think of, we do see higher incidence here in Alaska and in this region. The sensory neural hearing losses, any of the syndromic type hearing losses, any of the familial hearing losses. But a big thing too is, kids who are exposed to noise earlier. So, we have our older boys that, have been going hunting from they were, from they were younger, and other types of noise exposures being on, or great boats. But, those engines are pretty loud. And so, we do have that, the sensory neural hearing losses, and then just a mixture of both. There's a lot of factors that increases the amount of incidence of hearing losses, but that's why we're kind of so important here, and the work that we do. It's interesting and challenging. We here at BBHC, we do provide the whole gambit of hearing testing, from the VRA, where we use lights to stimulate the kids, try to get them to respond, play audiometry, we're down on the floor with them doing all kind of getting hearing testing through play. That could cover or 0 to 3 for VRA, then 0 to 3 to 5. So all of our little kiddos. We also provide, the newborn hearing screenings as well. Kiddos who've left the hospitals in Anchorage or the bigger cities before, if they were discharged before they're screened. We provide the newborn screening here, or any kiddo who was born outside of those hospitals, whether in their villages or here in Dillingham, we do provide the newborn screening. Since Sean or Dr. Smith took over, he was here before me, and since he took over, he did identify some limitations with that. We kind of brought the newborn screening to be more centralized in audiology. So we are actually overseeing the newborn screening. We're working with the state, whatever kiddo that's missed, kind of they let us know, and we try to reach out. So whether it's having them come here, or we've gotten equipment that we're able to bring to the villages as well. So wherever we're able to kind of get these kiddos, we try to get the newborn screening done. And then obviously the big challenge, hearing testing typically is done in a large sound booth. We have a lot of specialized equipment. And even the therapy, the hearing aids, things like that, a lot of times the thought is to do all of that in person. We've worked a lot, it's just a region specific thing, but we worked a lot to kind of do a lot of telehealth work. So whether we're consulting with the with the ENT team in Anchorage because of any post-surgical stuff, or any chronic issues that need their specialized care, we kind of consult with them. We coordinate or at least help to coordinate some of the ENT visits here, and coordinate service, surgeries and things like that with the ENT team. And as I mentioned, we do we work with the rehab, the hearing aids. We don't have the ability to do things like, the cochlear implants or any of the implantable hearing technology, but we do work closely with the hearing implantable team in South Central. And so, whatever the kiddos need, we either have the facilities here, we try to make it work here, or we have the relationships to kind of get them, referred to whoever they need to be referred to. We also assist with the IEPs and the 403, the 504 plans. So, we're here if the need is there. Some of the projects that we've been working on, so we have identified that we can do a little better with telehealth. And so we've been working with our folks in CHAP to develop some training modules that will focus on ear pathology and ear exams. Just to make sure that they have all the tools that they need to identify issues and get those issues to the right providers, whether it's physicians or advanced practice or APPs here in Dillingham or at BBHC, or whether they are consulting with ENT. We kind of want to make sure that they are able to capture the problem well, and so we're working on some modules to kind of refine that. They're doing an awesome job, but there's always room to grow, and so we've been working on that. This past year, optometry actually led this push, but the hearing screenings in the elementary schools, in some of the bigger elementary schools, we provided equipment and training for optometry techs, which they did an awesome job getting out to some of these communities. And I think in the elementary school here in Dillingham, I think it was them as well. And I think Dr. Smith also was a part of the screening here. So hearing and vision screenings, here and some of the larger schools. So, between us and some of you all that are doing that as well, hopefully we're able to kind of capture some of that need. So that some of that 30% need to kind of get all of these kiddos hearing the best that they can. And then some future projects that we're looking into. There's always a need to increase telehealth. That's kind of the game when we're covering 21 villages and it's 2 audiologists to try to cover all of that space. We're looking into some unique ways to increase telehealth. We haven't started this project yet, but we've been talking about figuring out how to do some of our hearing aid programmings in the villages, things like doing some VTC appointments and things like that. So, it's increasing our telehealth presence so that we can be more places. And one of the big things that we have identified is the noise-induced hearing loss, or the hearing loss because of noise, increasing access and also increasing education about the use of hearing protection, how to use it safely, how it can be effective. The complaint that we hear all the time is, I'm not going to use it because it prevents a safety barrier with what I'm doing. But if we're able to give education on the best types of hearing protection and how it could be used in a safe way, those are some of the things that we're kind of looking into and hoping to kind of expand some of the access to some of these things. So that's what we have.
Okay, everybody, I'm Denise. Nice to meet you. Oh, cool. And I just have to say thanks for having me. I owe a huge thanks to Susie Nunn, who has got diabetes into the fold with like the little kids that we love. And then, man, your whole crew is super energetic and your program is exciting. Did I say your name right?
You did.
Okay. So anyway, excited to be here. Didn't expect to. So I'll make it short and sweet. No pun intended. Or pun is intended. Here. This one?
No,
Oh, there you go. Oh, can't really see it, but in a nutshell, I know you guys have been in Bristol Bay a long time. The diabetes community wellness program's been around for 27 years, and I know you've been engaged with lots of different people in this role as a program coordinator and different nurses and providers. But throughout it all the iterations of this program, it's the same focus. It's about treating, managing people with diabetes. It's also about the prevention and the education in the community. So same focus, different people. And so what we do in a nutshell, we have our diabetes clinic here in the hospital downstairs. We usually have a provider there. Right now, we're getting a lot of help from different providers to cover us. Grateful for that. So people come in from Dillingham for those visits. They also do VTCs there within the region. In addition, we go out and we do nurse visits in our diabetes clinic as well, talking about blood pressure, sugars, foot exams, things like that. We go out to village visits when we can, always weather depending. But this is when we get to see patients in the clinic along with the provider, and also the big hit, the greatest thing that I got to do this year was go to the schools. And I hadn't been out there. And so we do a school presentation and education for all the kids. And then we try to do a community presentation as well, where we invite the whole community in if they're available to hear us talk about something like blood pressure, something like that. And then we are trying to get even more involved in community engagement activities about what you eat, how you move your body, drinking water. So that's what we've been trying to do. And then ongoing collaborations with our programs that we have here, which has been great. Okay. In a nutshell, we are trying to promote generational wellness. So when we go out, or if you participate in a 5K, whatever you do, we're going to give you a t-shirt for it. part of this beautiful t-shirt somewhere along the way, but this is what we give out to the kids, and we are talking to them. And as my predecessor Diana would say, Alaska's got the healthiest diet here. You know, it's just all the processed foods and the lack of some of our nutritious vegetables and fruits that throw things off. But we want the kids to recognize they're already living in a state that has an abundance of very, very good food. And so that's kind of been our, I don't know, guiding light, whatever, star, North Star, or something, is that we want to promote wellness, right? And so we did receive a grant this year from CDC and ANTHC to increase physical activity in Dillingham. And the reason was in Dillingham because this was a grant that was based in a larger city-like area. And the whole goal was to increase activity-friendly routes to everyday locations. So getting people out walking and doing things. And that grant is wrapping up this month. And we will have invite people to join us, and we'll let you know what happened with that. We also received a grant from ARP to purchase benches and tables and bike racks. And this is, of course, is to increase physical activity here. Some people can't walk the whole distance, so they may not get out and walk. So if we have some park benches or tables that people can take a break and get up and go, that's to increase that, and also to enhance some of the aesthetics. And then we're totally looking for a grant or partnership with anybody interested in food security. We know that that's a huge social determinant of health for our patients. We've all had the experience of going to the villages, and buying a bag of apples was my experience. That was almost $50, and there were a couple that were rotten in there, and it's heartbreaking. And what I found in traveling to the schools, which has been an absolute treat, is that many of the schools are kind of starting down this path of teaching the kids to grow food. So they have like a greenhouse that may just need a couple fixes or a little bit more money. They have some hydroponic stations that they're working on, as well as our Dillingham school is, and you know, to incorporate that food in the daily lunches for the kids. So we're big fans of this because we can't go around and tell people, hey, don't eat this or that, when your choices are very limited, right? And so we know we need to address social determinant of health, and food security is the one that we are addressing. So we did a short survey. We'll talk about the results of that, but over 50% of the people we surveyed throughout the region had food security issues. So this is something that, like I said, we would love to team up with anybody. I was going to ask you guys what you're doing with food, because I thought a food bank there.
Yeah, food banks in Mary Jane's department, but I just been sort of bypassing this grant that keeps showing up for increasing nutritional food access to Head Start food. So I will go find that.
Yeah.
And we'll talk about it.
Yeah, great. And so, yeah, so that's what we're up to. So a lot of other projects other than seeing, just seeing patients in the clinic. And then these are some of our fun activities, and we could never get any of this done if it wasn't for this woman over here, Cynthia. Yay. So it's anything and everything. Does it make such wonderful edits to some of the stuff that we send, and then just makes it beautiful. So that was an example. We had a Move in May run. That was a lot of fun. We had over 50 people. You might have said it was just a cold day here, but you know, it was wonderful. Lots of t-shirts. We support any village activity. So Cligonic did their own fun walk in the village. I think over 20 people joined that. We of course joined Susie and the gang for the Solstice Jamboree. And those are always fun trips. And the food security postcard, we did have a Zumba class. We had a good turnout for 5 or 6 classes. And then there was a lot of me and the instructor doing things. But I am a healthy. And I do want to mention, we have started bringing out fresh produce to the villages. And the reason why we do that is we normally would bring it to the school. We bring kids grapes, you know, the little things that maybe they don't have in their local stores. But it turned into more of a community was enjoying some of these fresh produce bags. And we also have Dr. Cooper, who provides oversight and sees our patients, and she's very excited about food security, so she likes to bring fresh produce. So when we do go out to the community, and I do talk to the principal of the school and look for, larger families, family that may need more, we do hand out fresh produce instead of, some of the stuff we were handing out before. It's just a better thing to hand out, a healthier thing, and always, we can talk about food and how important it is. So, I don't think I had a Quayana or anything like that, but a huge Quayana to everybody here. It just makes me proud listening to all these things. That's what my boss, she's so busy. No, it makes me proud. And I like learning all these little things about Bristol Bay because I see so many connections and possibilities. So, and the work you guys are doing is great. So thanks so much.
That was a perfect segue to our closing announcements. Just hearing all the incredible things going on in all the different departments. As I said before, we're Alaskans, we're creative, but Dillingham and Bristol Bay is really, really creative in how you're offering care and support. We have drones, we have hiring like kids from the school to like get them into the workforce and pay them for the hard work that they're doing. We have mentorships, we have hearing protection. We have so many cool, incredible things that are happening here. And just as now a new friend and a partner, I just feel so proud and grateful for you all. And the determination and resiliency that you continue to show every day in your roles and in your communities and in the villages that you support. So thank you for all that work. I know everyone online, I'm sure, is like, oh, we need to call in and we need to tell Dr. White. We have lots of things to follow up on because of all the creativeness here. So and yes, please,
Yeah, I
Lauren.
just want to say, so I think I told you before, I had been with my prior organization for 30 years, and I literally answered an email on a whim and decided to go on an adventure of a lifetime, which lots of people have lots of thoughts about. But I have to tell you that, I've been here a little over 3 weeks now. It is just like a dream come true to be here and to meet all of you and to hear about all the exciting work that's happening, everything from colon cancer screening to, audiology screens to all the work that you're doing. It's just incredible. And my heart is so full and I'm so excited to be here. And I know I have a lot to learn about the state, but if I can help any of you in any of your work, I am one that will like if you need someone to talk at the school or you need some parent education or anything that I can help with, I would have now I know to get on the mailing list because I would have gone to that little thing last night. But if I can in any way assist and participate in the incredible work that you're doing, I would welcome it and love to. And today has just been wonderful. So thanks for all of your presentations and all of your incredible work. And it's so impressive for somebody who's coming in completely from another kind of world. But it's really a lot to be proud of. So please utilize me. I would be more than happy to jump in and help in any way that I can, including things that.
You on the HSAC list, ICHID list.
Thank you. Thank you.
Connection, and what a great space to have kind of your debut of the wonderful work that you're going to bring here to the region. So we were able to talk a lot about Help Me Grow to our partners over the last couple of days. We have a lot of Help Me Grow materials and are happy for people to take them off the table. And we've got lots of freebies, and feel free to connect with us. Any of the service providers, we can share our materials, any of them in the folder with you and send them to you.
Can I take a
So
picture of it?
with that, we're gonna go ahead and wrap up our meeting. I know we have a flight to catch. The sun is shining. The plane's gonna get there, so we're gonna run. Yeah, and pack up quick. Thank you all. Truly, this has been just a dream of a trip for our kickoff season and just to be with our friends here in Dillingham. So thank you all. Appreciate everything you do.
I'm gonna ask everybody to line up over here. We're gonna try to get a quick group picture before our guest has to go.